Welcome to the deep dive. Today we're jumping into a really fascinating question, one that's kind of reshaping medical research.
Yeah.
Who actually gets to author important scientific publications? We're looking at a compelling publication today by Phil Leventhal, Danielle Drachman, and Soren Skovlund. It's titled, Can Patients and Caregivers Be Authors of Peer-Reviewed Publications? So our mission for you, the listener, is to really dive deep into this whole idea of patient authorship. We want to unpack why it's becoming so important, what challenges it's facing, and what this shift could mean for medical knowledge down the line.
Exactly. And this exploration should really highlight how that real-world lived experience is genuinely reshaping the scientific landscape. It shows why these voices aren't just sort of nice to have, but increasingly essential. Okay, let's get into it.
Right. So to start off, what exactly is patient authorship? Or I think the article also uses the term an author with lived experience.
Yeah, it's a really key part of a much bigger movement, called patient engagement. Think of that as the umbrella term, getting the patient voice involved at basically every stage, from trial design to health policy.
Okay.
And authorship is, well, perhaps the most formal recognition of that partnership. It means patients, maybe caregivers or reps from patient groups, become active partners in the research itself.
So they're involved in the planning, the interpretation.
Exactly. Conception, planning, doing the research, interpreting it, even spreading the word afterwards. The fundamental idea is that people with that direct first-hand experience offer unique, really invaluable insights. Like they might spot gaps in the research questions that, frankly, clinicians might just overlook. A patient might say, look, pain relief isn't the whole story. I need a treatment that lets me, say, lift my grandchild. That's a nuanced outcome a standard trial might miss.
That makes so much sense. And the article definitely points out that patients often have quite different priorities, different preferences for treatments compared to clinicians. And it sounds particularly vital in areas like rare diseases, right?
Yeah.
Where there's just less information overall, making that patient perspective even more critical.
Absolutely. In those cases, sometimes the lived experience is the best data you have.
So this sounds powerful, but how are the sort of official gatekeepers reacting? Is this being recognized?
Well, what's really striking is how patient authorship is increasingly recognized as essential and valuable by major bodies. Think the US FDA, other regulators too.
Okay.
Having them involved actually validates the research's relevance. It boosts its credibility, makes it feel more real, more impactful for other patients.
And it sounds like this isn't just theory. The paper mentions the number of publications with lived experience authors is, well, it's still low, but it's growing fast. A clear trend.
Yes, definitely a clear upward trend. The momentum is there. But despite that, there are still significant barriers. It's not all smooth sailing.
Ah, okay. Like when?
Well, there was a survey back in 2021. I think it was 112 editors-in-chief. Nearly a third felt patient authorship was, well, inappropriate.
A third. Wow.
Yeah. And some felt patients really needed some kind of academic affiliation. Now, this isn't always, malicious resistance. Sometimes it's just baked-in tradition about academic rigor or maybe legitimate concerns about training or how to manage that input effectively. But it does show a real cultural shift is still needed.
So how does this fit with the existing rules, the guidelines that journals use? Can patients actually meet those strict authorship criteria?
They absolutely can. The big one is the International Committee of Medical Journal Editors, the ICMJE. They lay out 4 main criteria for authorship.
Right, I've heard of those.
Yeah, they cover things like substantial contributions, critically reviewing the work, giving final approval, and importantly, taking accountability for the whole thing.
And patients can meet all 4.
Yes. The key insight is that these criteria, which are really the gold standard, focus on contribution and accountability, not whether you have university letters after your name. So a patient who significantly shapes, say, a study's direction based on their experience, or who critically interprets results saying, here's what this really means for people like me, they absolutely meet that bar. Their unique view can be vital for ensuring results are communicated in a way that actually resonates.
That's really encouraging to hear, that the main bodies support it. The 2022 Good Publication Practice Guidelines, the GPP ones, they specifically mention patient authors too.
They do. They explicitly state patients may be included as authors or contributors. It's a clear endorsement, which helps pave the way.
But you mentioned hurdles remain.
Yes, a couple of main practical ones still need ironing out. First is, how do you systematically identify these potential authors while respecting their privacy? It's a sensitive area.
Yeah.
One study found 95% preferred listing a patient advocacy group instead of personal details. So finding that balance is key.
And the second issue.
The second is just a clear need for more education for everyone involved, really, both patients, so they understand the role and expectations, and clinicians and researchers, so they understand the value and how to collaborate effectively. These are definitely hurdles, but, they seem surmountable.
So wrapping this up, what's the big takeaway here? This deep dive really shows patient authorship isn't just a niche idea anymore. It's a powerful, growing phenomenon adding real, immense value.
Exactly. And if you zoom out, connect it to the bigger picture, it just underscores that expertise isn't monolithic. It comes in many forms, not just academic credentials.
Right.
When you think about how medical knowledge has traditionally been generated, this shift, it isn't just a small tweak. It feels quite revolutionary, almost democratizing expertise. The ongoing work to formalize this, encourage it, will definitely make medical publications more relevant, more trustworthy, and at the end of the day, more beneficial for everyone.
So here's something to think about. How might integrating these authors, these voices with lived experience, transform not just what gets published in medicine, but maybe how we think about who holds valuable knowledge in pretty much any field?